Thank you for joining me on the Bold Lines podcast. Today, we're going to be talking about how mental health shifts in recovery. When we're talking about recovery today, I'm talking about the move away from substances, drugs, alcohol, pills, marijuana, high levels of nicotine. We'll get into some of that here in a minute. But we need to know what happens in our minds and our specific mental health symptoms. What happens over time as we stop altogether or we can slowly taper away. The majority of information today around mental health is going to be focused on anxiety and depression. Now, why is that? It's not just because those are the only things people can deal with in recovery and sobriety. It's just the ones that people tend to see the most, and they're the most malleable. Of course, there are different diagnoses that have different levels of both, but that's usually what people come into therapy or go into treatment and are concerned about. I will also say that mood disorders can be in here as well, whether that's something more direct, like bipolar disorder or cyclothymia, or just other versions of high highs and low lows that aren't exactly categorized. This episode is about all kinds of drugs, legal and illegal. I am going to be including marijuana or THC and nicotine because of vaping. And I've talked about this in an earlier episode about how high levels of marijuana and nicotine tend to be replacing alcohol for teenagers and young adults. So we're going to be incorporating that today because I think it has a lot to do with how we see mental health. Let's first talk about what is often considered a mental health disorder while using drugs, alcohol, or other substances. I will say in the midst of using any of these substances, it is very common for people to get diagnoses that they don't actually need or reliably and adequately apply. Some of these diagnoses that people can get are bipolar disorder, generalized anxiety disorder, or depression. There are plenty of other ones as well. Even sometimes people can get personality disorders that don't actually apply. Now, some people might be saying, well, if the symptoms apply, why doesn't the diagnosis apply? Well, the diagnosis, or at least the correct one, should be focused on what other factors are in play. However, one of the big issues that tends to come up, at least in what I've seen in my practice over the years, is that some people aren't always honest with their doctors or the provider in front of them. They don't tell them how much they use of something, and they get a diagnosis that doesn't actually fit. What we should be getting, or what we should be giving as providers, are called provisional diagnoses. Those are just what fits at the time. This is actually one of my gripes with some of the mental health categorization is that a lot of providers will just mark a diagnosis and there's not a little asterisk or something along those lines, meaning this should be reevaluated down the line, like 6 months from now. And so people get diagnoses that sort of fit at the beginning, but it follows them for the rest of their lives. Another conversation for another time, but you at least need to know that there's these things called provisional diagnoses. They're just like all of the other ones, but we don't want to make any hard assumptions until some time and work has passed. Let me give you a amalgamation of stories that I've heard over the years. Clients and patients that I've sat down with a common complaint or a common concern. I've worked in facilities for years, and I've been in private practice for years as well. And one of the things that I've started to notice over time is just how fractured our health and mental health system is. I'm not exactly sure how to fix it, but it's worth noting just how disconnected everything is. One of the things that I've seen over the years is people getting diagnoses that don't necessarily apply to them because of their drug or alcohol use. I'm going to use one of the most extreme examples to make a point. Feel free to break it down or correlate that into less severe categories. Let's say that I have an adult male in front of me. We sit down and have a conversation. He's just been admitted to rehab. As I'm having a conversation with this man, we start to talk about what kind of mental health episodes and diagnoses he has. As we're speaking, he gives me the diagnosis of bipolar 1. He said that's what his doctors diagnosed him with in a previous doctor's appointment or a trip to the hospital. Now, as a reasonable mental health provider, I'll make note of that and put it in his chart. But I'm someone who's a little bit more skeptical than just the average mental health provider. I start asking questions. Wait a minute, why? What was happening? What did you talk to your doctor about that gave you this diagnosis of bipolar? This patient goes on to explain that they told their doctor there were these days, or it's these times where they would just stay up, have massive amounts of energy, have promiscuous sex, and just engage in behavior that they wouldn't normally engage in. Afterwards, they'd crash for a few days or even a week after, being unable to get up or be motivated about things. This is a common complaint for someone with bipolar disorder. Unfortunately, the man in front of me didn't tell his doctor he's been using methamphetamine. In fact, he was injecting it through a syringe. Why is that important? Well, methamphetamine is a stimulant, a high-level one at that. It makes your heart race, your brain move fast, and shuts down some of your more intricate thinking capabilities. You're more prone to take high risks and stay up for long periods of time. Do you know what happens after you use meth? After you've come down off the high and you don't take any more? You crash because your body has to catch up to all the energy it spent. Your body has to collect itself. And so there have been many cases of the man in treatment, as well as people in my private practice office who have used things like stimulants, whether that's abusing something like Adderall or other prescriptions. They get a diagnosis of bipolar disorder that 100% doesn't fit. Is there room in the DSM for bipolar disorder onset by prescriptions or drugs? Sort of. But that doesn't mean that that's what providers always look for or put down. What happens to mental health during the use of drugs and alcohol? I will say things like bipolar that we just spoke about, anxiety and depression are very, very common. In one of the previous episodes that I referenced just a minute ago, I talked about how high levels of marijuana and nicotine can greatly affect people's brains, making them more anxious or depressed. This is something that I've seen over the years with teenagers start to grow. As they use these high levels of substances, their brain chemistry changes and they become more lethargic, less motivated. They struggle to engage with hopes and dreams in the people around them. We could call that depression, or we could say you're taking massive amounts of a substance that otherwise you would only be able to get from 2 or 3 days of continuous use. So there are plenty of these kinds of symptoms that people get. High levels of anxiety. Some people get anxiety when they use substances. Some people get anxiety when they're coming down off of them and feel like they need more. All of these provisional diagnoses should pass, though. In early sobriety, I do focus on sobriety in my work, not just recovery. Recovery can be this overarching term. I like sobriety more. Once you've gotten off of these things, the bipolar, anxiety, depression, whatever it is, all of a sudden your brain doesn't have that chemical barrier, doesn't have that way to compensate for whatever is going on. Your brain has to get new functioning, has to figure out its equilibrium. Because of this newfound sobriety, some people can have higher levels of anxiety or depression because the real world hits them. Imagine you'd been drinking your problems away for years. All of a sudden, you have to become sober because of a court order or a disgruntled spouse. Of course, you're going to be anxious. You're hit with the weight of all of your decisions. And now there's nothing stopping those from coming to light. This is another reason why people can have depression. When you have a greater awareness of the world, when that filter is gone, things have a greater impact on you, and your brain hasn't been used to dealing with these higher levels of emotions. It's important to know people in early sobriety feel as if the world is very loud and very bright, when in reality, their eyes have been closed. Much like when people go to sleep and the lights are flipped on, it seems too bright. The same thing happens when people finally get sober. Once our eyes adjust in the mornings, the light isn't so bright. It just seems normal. The same thing can happen when people get sober. Our emotions and fears can die down over time. It's incredibly important to understand that. Whatever you're feeling in early sobriety shouldn't be taken as a persistent truth. Let me say that again. What you are feeling when you are newly sober is not the truth. It is just your brain trying to catch up to all of the things that you've shoved down. In cases like these, where life seems overwhelming, as if emotions could swallow you whole, people can take low levels of medication to slightly dull the effects. Now, why would this be a good thing or bad thing? For some people, these emotions can be so overwhelming that it affects their ability to function freely. For others, they use this as another way to avoid the sense of guilt or shame they feel for their poor decisions and selfish actions. I am an advocate for low-level medication if the client or patient feels it's a necessity and we speak about it together. You should know, though, the goal in early recovery is to get stable, not to feel as if everything's okay. If you have to get sober, things aren't okay. So it shouldn't be my goal to make it so for you. Now, if those low-level medications can take the edge off enough for you to do work, I consider them beneficial. So as things start to settle, as people are able to see more of what's actually going on, we get a clearer picture of what's happening. Someone's brain starts to make sense of the world. Some people can taper off medication. I am under the impression that this should always be a consideration as a carte blanche, overarching blanket assumption for people. I am not in favor of everyone taking medication, much like I'm not in favor of everyone having to go to therapy. I really want people to be self-sufficient to as great of a degree as is possible. Now, there is obviously a caveat. I will say some medication is absolutely necessary. Some of the most obvious cases include schizophrenia or true bipolar disorder. If you are seeing evil things come out of the floor, the shadows are moving, and people are talking to you when no one's actually there, you need to take your medication because no amount of therapy will convince all of that stuff to go away. It's a brain issue. And in that case, please take your medication. However, if you are someone who is in early recovery, early sobriety, you're working on yourself and things have settled, you can consider lowering medication around anxiety, depression, or some other mood stabilizer, as you can gain greater confidence and not have to rely on something to keep you stable, you can get that bug out of the back of your head that says you're not going to quite make it, and you can start to take charge of your mental health and what's going on. At this time, we can start to see if anxiety and depression are due to grief or if they are due to a brain issue. Sometimes people's anxiety, depression, or other symptoms are due to the realization of the terrible things that have happened or the terrible things that they have caused. In some cases, though, people really use medication well by addressing brain deficiencies. Now, is that brain deficiency something that came from birth? Or is that brain deficiency something that arose due to the use of substances? At this point, I don't know. If I have someone in front of me that used a substance for 10, 15 years, they're now sober and they're doing well, and let's say they've spent some time and want to lower medication and still feel anxious or depressed, and they've truly addressed things in therapy, I have no idea which one it is. And at this point, it's too late to tell. So I treat all of those cases the same. If it's a brain issue, let it be a brain issue. If it's a personality or a character issue, let's treat that instead. As these things have started to settle, it's a good idea to have a higher level of personal accountability. In therapy, I encourage people to be more focused on what they can do. If you've been stable, you've been away from substances, and you've been able to find a center, it's a good idea to consider what you need to do. This is one of the things that can really catch people up. Because typically, around long-term use of drugs or alcohol, there's been such little accountability that it can drift over into sobriety as well. And many people in recovery don't realize how much group, family, or couples accountability they've been let off the hook for. So let me boil this down for someone who has just gotten sober. Group or family accountability is going to be incredibly difficult and isn't always useful. As someone is sober for longer, though, they should be engaged. They should be challenged with the real adult situations and relationships that they've been avoiding. Now, if you've gotten to this part and said, okay, I understand that mental health shifts over the time period that someone's been sober, and what I may have experienced in the midst of drug or alcohol use isn't necessarily the truth. How long do I have to wait to really figure it out? I'll give you generally what I assume in therapy. Now, some different organizations will give you different time periods. I think there's a good argument for a lot of different things, but let me go ahead and just give you what I assume. For those that use substances in a quote unquote mild way, meaning that they have some sort of level of control, but it still overtakes them. Or if someone continually uses marijuana or nicotine on a daily basis, I usually give people about 90 days to come to center, engaging in daily life, doing what's required of them, and maybe some level of low-grade medication. I don't start making any assumptions about someone's mental health status until 90 days from their sober date. Where does that 90-day time frame come? It really just comes from years of practice and research. It's something that I find quite remarkable and something that a lot of clients underestimate. Is 90 days really different? Could I see a genuine change in myself? I would say absolutely. I would even argue that if you are working on a different skill, coping mechanism, let's say you want to spend an hour outside a day to change your mental health, or you want to start exercising regularly, I would assume around the same time frame. See how you are in 90 days of consistent work or consistent change, and you can start to examine maybe what you'd been missing out on. For harder drugs or more intense use of things like alcohol or pills or something like that, it could take 6 months to a year. I mentioned at the beginning of this episode, IV methamphetamine, and that one can take up to a year and a half. We've got brain scans that show that it can take that long just to settle. And so for the harder substances, the ones that have been used for a more intense and long period of time, it's going to take a while, and many people get discouraged. It's been 3 months. I've been working. Why do I still feel sad? Why am I still feeling this thing called anhedonia, the lack of pleasure? Maybe the world really just is sad, or there's nothing to my life. I would argue people need to wait. Your brain has to catch up. You've been abusing it for a long time. Give your brain some space to figure out what chemicals are needed and reset. The final thing I will say around this mental health and recovery topic is no one should make a final assessment until work has been done in their family and their relationships, especially in therapy. Just because someone's been sober for 6 months, it doesn't mean that a whole lot's changed. It just means they're sober. There's a term for these people in AA culture. They're called dry drunks. These are the people that haven't changed themselves, their personality, or their expectations, and are still miserable. But they're sober. Hooray. Don't be one of those people. And don't make any assumptions of yourself until you've done some true exploration on why you do what you do, and try some real intervention to see what you're truly made of. And so for anyone listening that's made it this far in the episode, if you're thinking about leaving a substance behind, whether it's THC, marijuana, and vaping, if it's nicotine and vaping, or just smoking of either one of those categories, if it's a harder drug or recurrent alcohol use, give yourself some time before you make an assessment. If you're seeing some sort of health or mental health provider, you can bring up this topic. Bring up this podcast and say that, well, whatever diagnosis you give me should be provisional, should be temporary. Even if it's something you keep in your own head, I want you to stop and realize that what you're feeling now is not very likely to be the truth later. Give yourself and your brain some grace. Thank you for listening today. I hope you found something useful out of this episode. If you feel so inclined, I hope you follow the podcast so you can get weekly downloads every Tuesday. You can also share this episode with others that might find it beneficial to their own lives. And if you feel the need to, you can drop something in the tip jar to help pay for the production of this podcast. Thank you. Have a great day.